Hey everyone, thank you so much for watching this video. As you probably know, I'm Sarah Hornsby and I'm your online myofunctional therapist. And today I'm going to talk about underbites. So many of you may have seen someone where you think that their bite or the way that their teeth meet together looks a little bit different. And what I'm talking about is what we call in the dental world a class 3 malocclusion or an underbite. So why does this matter to me as a myofunctional therapist? Well, people who have an underbite also have myofunctional issues. So if your mandible is pushing forward, you don't actually have too big of a lower jaw. What's happened is the maxilla, the upper jaw, is really what's too small. And although it looks different from the stereotypical retruded mandible or small lower jaw that a lot of people with myofunctional issues have, it's actually the exact same thing taking place. The tongue is resting in the bottom of the mouth, usually because of a mouth breathing habit or a tongue tie or a tongue thrust swallowing pattern or all of the above. And the breathing is usually through the mouth. So the problem with this is that when people have a class 3 bite, they often need jaw surgery. So what I want to talk about today is that you don't always need jaw surgery. If you can intervene, if you see that your child is 3 or 4 or 5 and they're already developing an underbite, a lot of times it's hereditary. It tends to run in families. So if mom or dad has an underbite, so will the kids, or maybe the kids will. So if you can see that growth pattern starting at an early age, you can do some early intervention. I never ever want people to think that they just have to wait until their kids are 18 or 19 and then have jaw surgery. So the first thing that you should know is you don't have to have jaw surgery if you can intervene earlier, or at least we hope that you can prevent that from happening. So if you can get the type of orthodontic treatment that I usually talk about, like the ALF appliance or a DNA appliance or orthotropics, and if you do myofunctional therapy and get the tongue in the roof of the mouth so that they can learn to swallow properly, breathe through their nose, and that even though they have that growth tendency to go under, if you can get your tongue in the roof of your mouth, you can really prevent that growth from really taking over and accentuating. So the other thing about having a class 3 malocclusion or an underbite is that you have to do myofunctional therapy if you have jaw surgery for this. So if you do end up as an adult and you have jaw surgery, the thing is you've got to make sure you get your tongue in the right place, you learn to swallow properly, and you learn to breathe through your nose. If you don't do this, your jaw surgery can actually relapse. And this is really, really common. There's so much research out there talking about the long-term stability of jaw surgery. And when I say this, I'm meaning where the upper jaw is brought forward and sometimes the lower jaw is brought back a little bit. If you're someone who has an underbite, you have underlying myofunctional issues like 99% of the time. So if you don't fix those myofunctional issues and you go have jaw surgery, it's going to undo. I know that sounds crazy. How can a jaw surgery relapse? It happens all the time. People usually get an open space between their molars or between their front teeth, and they can no longer bite properly on their teeth. I've seen people have jaw surgery twice and have it still relapse. And I see every single day, I see people who have had some type of orthodontic relapse or jaw surgery relapse. So I'm not just making it up, I see it all the time. And I know it's preventable, so I'm not saying that these surgeries are bad. They're just not helpful if you don't do myofunctional therapy along with them during either before, during, or after. In an ideal world, you would do myofunctional therapy through the whole process. Anyway, I hope this video makes sense. I hope you can learn a little bit more about an underbite and if you need jaw surgery or if you think your child is going to need jaw surgery because of an underbite. And I'll keep making videos like this, so just let me know if you want me to cover any new topics. Leave some comments below, subscribe to my channel, and I will be talking to you guys soon.